everyone, thanks for tuning into A Cane on Pain. I'm Rashmi Kane, registered massage therapist, and today we're going to talk about tennis elbow. So when clients come in and they're suffering with elbow pain, first question is it happening on the inside? This would be golfer's elbow. If your pain is on the outside part of your elbow, you're most likely having some tennis elbow discomfort. And often people will say, but I don't play tennis. It's just a layman's term. The medical term is lateral epicondylitis. So you have your elbow bone, what we call the olecranon, and then you're just going to move a little bit outwards towards my thumb side. And this next bone here, this next little bony bump is called your lateral epicondyle. So here, all the common extensor tendons are attaching. So here, when you look at your arm, you're fleshier by the elbow and then you narrow by the wrist, because the belly of all these muscles here, the common extensor muscles, they're making this big, see this big fleshy area here, and then they act as strings as they come down here, as what we would call tendons, so that you can move your fingers. The main action of these muscles is to do extension to bring your wrist back. So a simple test to find out if you truly have tennis elbow, you need to have pain on touch, pain on stretch, and pain on resistance. So often if you have pain on resistance, you have pain with everything else. So let's test to see if you have any resistance. So you're just going to make a fist, drop your hands down, and then try to push your hands down and see if that causes you any discomfort. So in clinic, I would have my hand below theirs and see if they could extend their wrist back. If they're having any pain, they would have it all in through here, making them positive for tennis elbow. So what do? So first thing we would do is teach you how to stretch it. So easy stretch. You're going to have your arm straight out, palm facing towards you, and you're going to bring the wrist or your fingertips in towards you, stretching all here at the front of your arm. If you're not feeling as much, or a second stretch, you're going to rotate the arm. So keeping the wrist straight, you're just going to rotate at the elbow. So this here we call our cubital fossa, your elbow crease. So right now it's facing towards the back wall. So I'm keeping my wrist straight and I'm just going to rotate it so that it's now pointing up. And I'll feel a great stretch in through here. And you're going to hold 30 seconds to a minute. After you've stretched, you can go ahead and ice it. You can take a simple ice pack, wrap it in a towel, and put it around your elbow. You can take a frozen water bottle, keep your palm facing up, and roll back and forth, trying to focus as close as you can to the elbow. So as you see, I'm trying to rotate my thumb pointing down to really get in through the affected area. In clinic, what I would do is I would take a styrofoam cup, I would fill it with water and freeze it, and as the ice melts, I can peel the cup. This way my hand stays at regular temperature while I would ice the client. When you're using direct ice, you have to keep it in motion. And with ice, you always want to feel 4 stages. Like right now, I'm feeling cold, then burning, aching, and numbness. Once you get to numbness, you want to remove the ice, let the area get back to your regular temperature, and then you can proceed to do it again. After you have now stretched and iced, you can think about maybe trying to massage the area. So I have with me my yoga tune-up balls. There are 2 balls in a mesh baggie. You can also use tennis balls. You can take 2, wrap them in a sock, tie a knot, and then you have your own little homemade version. So same thing with the rolling of the ice. I'm going to have my palm facing up, and I'm going to roll back and forth. My table's a little bit too soft, so I have a book here. And I'm going to roll back and forth, working on these muscles here. Trying to get as close as I can to the balls. If you're finding this is also maybe not as specific enough for you and you'd like to go a little bit more specific, I'm going to teach you how to massage it. So I have with me my professional massage cream. Don't bother running out and trying to buy. Go into your pantry, see what you have. Coconut oil, vegetable oil, any one ingredient will work just fine. And I'm going to apply the lotion. You need lotion. I go through a bottle a day when I'm in practice. So I'm taking my thumb and I'm working, let me rest my arm, all into trying to get into that area. And you'll see, as soon as you start massaging in through here, you'll feel where it's tender. Any tender spots, you want to just stay and apply some pressure. If you feel like, see, I'm going, and then I'm going to get stuck, I'll just stay here and hang out and wait for the muscle to relax. You want to go within your pressure. See, I'm not making any angry faces. No, that's too much. You want to back it up. So working from the wrist all the way up, right into that spot. And see, I just flipped over something. That goes to show how tight that muscle is when it flips like that. So that's where I would spend a little bit more time trying to work it out. So I hope that helps in your home care treatment for tennis elbow. Until next time, I'm Rachel McCain.